On today's The Doctor is in, decoding your lab test results. A routine test can be downright cryptic when you try to decipher the abbreviations and the numbers. Dr. Scott Ackerman is one of the First Coast's leading doctors. He joins us today to help assess the numbers and clear up any confusion that you may have. Dr. Ackerman, thanks so much for being here.
Thank you,
Appreciate
Case.
you as always. So, results are often recorded in different units, and they can be pretty confusing for people who don't look at this stuff every day. Can you kind of break it down into layman terms, what they mean, layman's terms?
Well, when we get a lab result, we draw blood and we look for different things in the blood. We look for the hemoglobin or the hematocrit. We may look for your cholesterol or your sodium or your chloride, all those sort of things. And each of those things have different units of measurement. You may get a number, like your cholesterol might be 150 or 160. But that cholesterol of 150, 160 isn't just a number. It's an amount of cholesterol in, here's an example here, 148. This is a lab slip, and that's in milligrams per deciliter. So
Okay.
that's a amount of weight within a certain volume. A hematocrit is given in a percentage. So maybe a percent of the red cells in the hematocrit. So what we use is that we use metric units. So that's the standardization that we have in the United States. And that way we can compare blood results from one lab to another because we're all on the same sort of system.
Okay, so you're given a reference typically when you go in for your results, and you get a range for your results. What if your results are different from the range? And kind of break down what that means.
So when you get your cholesterol, let's
Okay.
use that one, there may be a reference range of what's normal. Or your glucose, there could be a reference range of what's normal. Your hemoglobin, a reference range of what's normal. So what the labs do is they test many people, hundreds of people, to find out what's normal in the community. That's what the reference range is, just what the average person's range is. So they test hundreds of people, and they find out where 90% of the people, where they lie. And we get, it's in statistics, it's called a bell curve that we get. So you find what the average amount is, and then you see where all the outliers are. So where 90% of the patient's value is for that specific test, that's the reference range. 5% will be higher, and 5% will be lower. And those are numbers that are outside that reference range. If your blood result, whatever it might be, is outside the reference range, it doesn't mean that you're abnormal necessarily. It might be that it's bad, but it also could mean that just for you, that's where your normal is. And maybe what's normal for you. And conversely, if your lab result comes in within the reference range, that may not be normal. Even though for you, it may be normal because you're within that range, but your physician should be looking periodically over time at that same test and see if there's any changes over time. For instance, let's go to the cholesterol again because we talked about that earlier. Your cholesterol may be within normal range, but if one year it's 140, the next year it's 160, the next year it's 180, all three of those are within the normal range, but there's a increase over the years, so maybe that's the time to intervene and change your diet so you keep your cholesterol low.
Okay.
So, and also, you could get a result outside the normal range because of other factors that maybe the population didn't have, like maybe you're pregnant. And so you can have that would change things a little bit.
Exactly.
So you'll be outside the reference range, but that would be normal for you because you're pregnant. If you're taking certain medications or some supplements, that could also alter blood results. If you ate a big meal, if you have a big steak and then have your blood test an hour later, your cholesterol is going to be pretty high because it goes right into your blood system before it gets flushed out. And we could actually see it in the test.
That's why you fast typically before you get blood.
Typically, I always recommend to my patients, regardless of what test they have done, that for 4 to 6 hours before the blood test, they just drink water and nothing else. So it's always best to get your blood test first thing in the morning, because usually you're not eating all night. And don't eat breakfast, just have some water in the morning before you have the blood. You don't want to be dehydrated. That's also not good. So drink water, but don't drink coffee or have a breakfast before you have your blood test. Also, if you smoke or if you're under stress or you've been exercising, those can also change your blood results as well.
Okay, and do all lab companies use the same reference range? Can you expect the same kind of thing when you go to different labs to get tests done?
No, it could be different. The reference range is what's done here in Jacksonville at our labs, but in Topeka, Kansas, the population may be a little bit different. Also, different labs use different equipment, different standardization, so there could be some things that are a little different from lab to lab. The one thing that's pretty standard, however, is cholesterol and blood sugar. These are pretty much standard ranges. The other tests, they vary a bit from community to community because of differences in the community and also differences in the labs. So it's always best if something's a critical value, you want to test it at the same lab when possible.
Okay, and then, we hear this with breast cancer that, some people will get a false positive or a false negative. What does that mean when you get that kind of test result?
So with breast cancer, if you have a mammogram that shows something we have normal and we biopsy it, and the biopsy is just benign, we call that mammogram a false positive. The same sort of thing can happen in blood tests. So, we drew the PSA for prostate cancer, and the PSA prostate cancer could be elevated, but then the biopsy is benign. That'd be a false positive. Conversely, if your PSA is normal, but you have a nodule in your prostate and the biopsy is positive, that's cancerous. So that would be a false negative. Yeah, false negative for the blood test. So regardless, be educated about your test results. It's best to review them with your physician, whether they're positive or negative.
Yes.
It's best to review with a physician so you understand the whole picture.
Instead of just getting a phone call or something and, having it say, oh, you're good to go. You need to sit down and actually decipher it. Thank you so much,
Exactly.
Dr. Ackerman, as always,
Thank
for
you,
being
Casey.
here. We appreciate you and for sponsoring this segment. And for all of the good advice, as always, you can go to Dr. Ackerman's Facebook page. You can ask him any questions that you might have. His Facebook page, again, is facebook.com/First Coast Oncology.